got a feeling that something ain't right. I'm just scared.
I first noticed the depression. I felt very low and negative about everything. And then I started experiencing anxiety, and that got worse and worse and worse, to the point where I literally felt like I was about to die all the time. I'd heard of CBT therapy for other things like education and for depression, but I'd never heard of CBT for trauma. I was really anxious, and I spoke to my doctor and explained my problems, and he recommended Cognitive Behavioural Therapy to help me with my trauma issues, and introduced me to Dr. Richardson, who was then my therapist.
So post-traumatic stress disorder, or PTSD as it's commonly known, is a mental health problem which people can sometimes get when they experience something really traumatic, a really difficult event. So this might be something like a car crash, or it might be witnessing war or experiencing abuse, being attacked. So this is something that can happen when really difficult things happen. It's like you're in the cinema and you're watching, you know, whatever film, and then someone puts on a horror film and suddenly bam, bam, you get this kind of unpleasant memories from the past put on the screen.
It's really hard to explain to someone who's not experienced it what that degree of fear is like day to day. I also started having flashbacks. I started having a lack of control over how I remembered the negative memories. They would just jump up on me. I'd be going about my normal day-to-day existence, trying to have a conversation, and then I'd be 10 years in the past, experiencing it as if it was happening to me all over again.
A really important part of it is something we call reliving. So what this is going through these traumatic memories again safely in a controlled way with your therapist. So imagine that you've got like a linen cupboard, an airing cupboard that's really messy, it's overfull, there's loads of sheets and duvets in there. The only way that you can actually keep those doors closed is you have to open it. You have to go through and you have to get out all of these duvets, all of these sheets, look at them, work out what you need, fold it up and put it back in neatly in a safe way, then you can close the doors.
The positives of the therapy are that it works. It works exceptionally well if you commit to it and give it your 110%. It's very hard. You're being asked to go back over difficult events and periods in your life which quite often you'd rather forget. So facing those traumas, being honest about them, just telling somebody was really hard. And that is both a negative and a positive, because by getting it out there, you're no longer keeping a secret, you're no longer feeling like you've got things trapped inside. Since I've had the therapy, my flashbacks have decreased from double digits a day to in between 2 and 5, sometimes 6. My depression is pretty much gone. I can go about my normal day-to-day life without feeling really down on everything, without feeling like there's no point. My anxiety is now normal. I feel a normal level of anxiety. I'm no longer convinced on a day-to-day basis that that's the last day of my life. I feel that I can live, go about my existence, go about my life, be comfortable in it, be happy in it, and not feel afraid.